There are many accelerators on hair growth, but the first one that I really want to underscore is blood flow itself, which equates to the delivery of nutrients and oxygen. This is very important, and it explains a lot of the treatments for halting and reversing hair loss. For instance, one of the longest standing treatments for halting and reversing hair loss is so-called minoxidil. Minoxidil, sometimes also referred to by the brand name Rogaine, was actually a drug that was developed to treat hypertension. So this is a cardiac drug that lowers blood pressure, and it does that by causing vasodilation. It allows more blood flow, not just to the hairs on your scalp, but to hairs everywhere on your body. And indeed, most people don't realize this, but minoxidil won't just slow the loss of hair from your scalp. It is also effective at slowing the loss of hair elsewhere in your body. How does it do that? Well, you now know one of the major ways it does that. It does that by extending the anagen phase. So it basically makes that phase a bit longer. It doesn't make it much, much longer, which is why for most people who are losing their hair quickly or who have already lost their hair, minoxidil alone is not going to be a sufficient treatment. However, minoxidil has been shown to be effective at slowing rates of hair loss in people that are starting to experience some hair loss. I'll get into dosages and things of that sort a little bit later. But right now, I just want to really focus on the logic of why people would take this drug, which is lowering hypertension at all as it relates to hair loss, right? That might seem like kind of crazy until you understand the anatomy and the growth of hairs, which you now do. So that's what minoxidil is doing. It's creating more blood flow to the hairs, which, because minoxidil does have this positive effect, at least most people would like to slow their rates of hair loss on their scalp anyway, it tells you that blood flow and delivery of oxygen and other nutrients from the blood is pretty critical, if not very critical, for the support of the hair growth cycle itself. Now, again, we haven't talked at all about the sorts of chemicals or the signals within the body, such as hormones, that actually direct the growth of hairs. Here, we're just talking about a mechanical change, allow more blood flow to the region and thereby extend the anagen phase, which is exactly what happens with minoxidil. Now, minoxidil does have other effects, and this is why dosing of minoxidil becomes a little bit complicated and can be a little bit tricky to troubleshoot. It can greatly lower blood pressure or lower blood pressure just a little bit, depending on how sensitive somebody is to that particular drug. So oftentimes physicians will start people on minoxidil dosages that are very low. Ideally, that would be the case, and then ratchet it up in order to figure out where the minimal effective dose or the kind of critical threshold is beyond which they start experiencing some pretty uncomfortable side effects, such as, swelling of the ankles or headaches or dizziness. These things can happen with the use of Rogaine, aka minoxidil. Now, minoxidil has also been associated with increases in the hormone prolactin. Prolactin is a hormone that's released from the pituitary. It is a hormone that acts also as a bit of a neurotransmitter, like many hormones, and it tends to be antagonistic or an opposite to dopamine. So dopamine is a neurochemical. It's actually a neuromodulator, meaning it modulates the activity of a bunch of neural circuits in the brain. It also controls the release of various hormones in the body. Dopamine is almost always associated with states of motivation, pursuit, and drive. It has a little bit of a kind of feel-good element to it, which is why a lot of people think dopamine is associated with reward and pleasure, but it's really about energy, motivation, and drive. Dopamine and prolactin are, as I mentioned before, antagonistic to one another. They're in sort of a push-pull. So people who take minoxidil, especially if they're very sensitive to it or they take dosages that are too high, will experience increases in prolactin that in turn can cause things like reductions in libido, reductions in overall feelings of well-being, apathy, and in some cases, where the elevations in prolactin are more extreme, they can experience, for instance, increase in male breast tissue, gynecomastia, or even small bits of milk letdown, things of that sort. In women who take minoxidil, the side effects are much like the ones experienced in men. So there can be swelling, edema of the tissues, because if you get too much vasodilation and too much lowering of blood pressure, that's not good. Headaches, dizziness, and so on. So dosing of minoxidil is really important. If somebody's going to use minoxidil in order to try and slow or reverse hair loss, and again, it mainly is going to be used to slow rates of hair loss, not to actually reverse hair loss, the really key thing is to get that dosage right. So the ranges of minoxidil that you'll see suggested and that people use out there are vast. And I should also mention that there are two major routes by which people get minoxidil to the hair follicle. One is to take it systemically as a pill, where it goes into the general circulation. The other is to take it topically as a cream. There are prescription and non-prescription forms of minoxidil, just to further complicate things. But the ranges of oral minoxidil that you'll see out there and that people take range anywhere from 0.25 milligrams all the way up to 5 milligrams per day. So that's an enormous range. It's like a 20-fold range. The topical minoxidil is also found in various concentrations. The typical concentration is going to be a 5% concentration that people will use once per day. Topical treatment with minoxidil at 5% concentration is thought to just stay at the scalp, but we now know that it can go systemically. It can get into the general bloodstream. Why that is should make complete sense to you, because when you put something on your scalp, I've already told you these little pits, these little tubes that go down to those bulb regions below the skin that have direct access to the blood supply. So when you massage something into your scalp, it not only has the opportunity to get into your general circulation, it often does, especially if it's something that's very water soluble, and that way can get into the capillaries and into the general bloodstream. Although topical treatments, of which we're going to discuss a number of them today, don't tend to get into the general circulation as robustly as taking something by way of pill or capsule. Okay, so minoxidil works by way of increasing blood flow to the stem cell niche below the hair. The dosage ranges of the oral minoxidil are tremendous, 0.25 milligrams all the way up to 5 milligrams once per day. The dosage range of the topical solutions tends to be a little bit more confined. Typically, it's a 5% solution, and it's recommended that people use it one time daily, maybe twice daily. It's also important, by the way, if you're going to take this route, that you actually leave that solution on the scalp for 3 to 5 minutes. This is important and should make complete sense as to why it's important. You can't just rub the stuff into your head and then rinse it off and expect it to be absorbed. It actually needs to seep down into those hair follicles and access the niche. How do people arrive at the correct dosage for minoxidil? Well, for better or for worse, really. In some cases, it's accomplished by finding out that you have an unwanted side effect, like dizziness or swelling of your ankles or edema, or I would hope this wouldn't be the case, but something that suggests there's hyperprolactinemia. You could get a blood test to measure your prolactin, or you perhaps notice a drop in libido or some lethargy, these sorts of things that are common to reduce levels of dopamine, increase levels of prolactin. I would hope that if people are working with a physician, or if they're not in taking minoxidil, that they would start with the lowest possible dose. So for oral minoxidil, that would be 0.25 milligrams, and then increase it as needed rather than jumping in right at 5 milligrams. Because some of those side effects, in particular the fluid retention and the hyperprolactinemia, can be pretty uncomfortable and can disrupt a lot of aspects of life that most all of us consider desirable. Okay, so we're really focusing right now on treatments that relate to the critical requirement for hair stem cells to receive blood flow in order to receive oxygen and nutrients to get the hair to grow. And that's really what minoxidil is about. It's also what all of those anecdotes you hear are all about, like massaging the scalp or putting red light on the scalp. Although red light might do some other things, in general, heating or lighting of the scalp or massaging of the scalp is really designed to increase blood flow to the scalp. Now, the reason minoxidil works at all is because it is going to increase blood flow around the clock. And that's because people are taking it topically and it's seeping into the general circulation, or at least is staying somewhat restricted to the hair cell niche, or they're taking it orally and it makes it to that hair cell niche below the follicle. When we massage our scalp, however, that's a transient thing. I can massage my scalp right now. I'm no doubt increasing blood flow to certain areas. I'm probably decreasing blood flow to the areas I'm pushing down on, but it's all temporary. I don't know many people that can massage their scalp enough during the day, or long enough during the day rather, that it would sufficiently increase blood flow. With that said, it is clear that increasing blood flow to the scalp by way of reducing hypertension, which is effectively accomplished by broadening, by expanding the blood vessels and capillaries, is an effective way to at least hold on to the hair that you have. Is it going to completely halt hair loss? If you have a strong genetic bias towards hair loss, no. Is it going to reverse hair loss? Very unlikely that it will, but it can slow hair loss or even maintain the hair that you have. So if we were to take a step back and ask ourselves, what other sorts of drug treatments are out there besides minoxidil that increase blood flow and that might increase the rates of hair growth, or more likely increase maintenance of hair that one already has by increasing blood flow to the niche? And nowadays, there are more and more doctors who are familiar with this requirement for blood flow, understand the mechanisms by which minoxidil works, and understand the vast desire out there for people to hold on to the hair they have and regrow hair. And they're prescribing things like low dose tadalafil, so 2.5 milligram to 5 milligram tadalafil. Tadalafil was initially discovered as a drug to treat prostate health. It was a drug that we now know can increase blood flow to the prostate and thereby offset some of the issues associated with an aging prostate. Higher doses of tadalafil, sometimes also referred to as by its brand name, which is Cialis, are used to treat erectile dysfunction, but at the dosages that are used to increase blood flow to the prostate, and that now a number of doctors are using to increase blood flow, not just to the prostate, but to all regions of the body, including the scalp, such as 2.5 to 5 milligrams tadalafil. So this is something that I think deserves attention because it falls under the umbrella of increasing blood flow to the hair stem cell niche in order to maintain hair. It is not something that most doctors are going to be familiar with as the way to reverse hair loss, because it won't do that. But the use of low-dose tadalafil to slow rates of hair loss is very much, in a logical, mechanistic sense, exactly the same as the logic of using minoxidil to slow rates of hair loss. It's all about increasing blood flow to support the stem cell niche below the hair follicle. The critical requirement for blood flow, oxygen, and nutrients to the stem cell niche is also why you hear a lot nowadays about the use of PRP, platelet-rich plasma, for trying to offset hair loss or even reverse hair loss. We're going to do an entire episode about PRP. It is pretty controversial in certain circles and well accepted in other circles. A couple of key things to understand about PRP. First of all, it is being used in multiple tissues for different purposes in different clinics. So for instance, board-certified physicians in the United States, Canada, and Europe are doing PRP injections into ovaries to try and expand the number of healthy follicles and eggs so that people can conceive later in life, or even earlier in life if they don't have many follicles. People are getting PRP injections into their joints in order to try and support joint health. People are getting PRP injections into just about every tissue you can think of. However, PRP, despite what you may have heard, is not stem cells. Somebody tells you they're injecting stem cells, they're either outside the US, Canada, or Northern Europe, or they're injecting something else. So you want to really look into that. The safety issues there are the subject totally deserving of an entire episode. I'm not necessarily opposed to the future of stem cells as a treatment, but keep in mind that stem cells are cells that can give rise to lots of other cell types, and they are cells that divide and replicate. And there's a name for that when it happens in the adult body when you don't want that, and that's called cancer. Tumors are overproduction of cells from stem cells when those stem cells ordinarily should be quiescent. Okay, so keep in mind the difference between stem cells and PRP. PRP, platelet-rich plasma, again, is legal in the US and many other places because it involves drawing somebody's blood, spinning it down at a particular speed, which separates out different components within the blood, then taking the platelets and re-injecting those in a solution back into the person's body. So platelet-rich plasma, or PRP, is platelet-enriched plasma from that person. But the basis of PRP is really to encourage nutrient delivery to a particular region in the body using somebody's own platelets, because those platelets are enriched for various nutrients. So people are getting PRP injections into their scalp. Those are not stem cell injections. Those are PRP injections into the scalp with some moderate success. These are very expensive treatments. They tend to be transiently successful. I'm sure there are people out there who are going to say PRP worked fabulously well for me. That might be the case. I'm not going to dispute that, and I'm happy for you, although there are not sufficient clinical data to suggest PRP as a treatment right now, especially given the cost, many thousands of dollars, many treatments. It's also the case that the PRP injections, when they work, might work for reasons independent of the platelets. What do I mean by that? Well, soon we're going to talk about a different type of treatment, which is a mechanical manipulation of the hair follicle, typically on the scalp, because that's typically where people want to regrow hair. I don't know many people who are trying to maintain or accelerate or regrow their back hair, for instance. They might be out there, but I don't think there are a lot of them, or their leg hair for that matter. Almost always it's going to be scalp hair. And one way that people are doing that is through mechanical stimulation of the hair follicle and the stem cell niche using what's called microneedling. Microneedling, as the name suggests, is taking a bunch of little needles, either in a little stamp, so a little square, or nowadays typically it's a roller. So it looks like a paint roller, except it's got tons of little needles in rows all over that roller. Those needles range in length from 0.5 millimeter to 2.5 millimeters, okay, millimeters. And one rolls that over the scalp. And if you're thinking, ouch, that probably hurts, indeed, it can hurt a little bit or a lot, depending on the thickness and the length of those needles. Microneedling has been shown to do two things. It has been shown to reactivate semi-quiescent populations of stem cells that are in that telogen phase, putting them back in anagen phase, and thereby stimulate more hair growth. It is also, and this is, I think, the best use of microneedling, it has also been shown to be a very effective augment for some of the hormone-based hair regrowth tools and pharmacology that we're going to talk about in a few minutes. So microneedling and PRP have something very critical in common, which is the needle, the actual injection into the skin. And for those of you that are hearing this and thinking, why would disrupting the skin with needles actually support hair growth or regrowth? Wouldn't that just damage the follicle? Well, this gets into some of the, I think, interesting, if not fascinating aspects of our biology, which is that all of the cells in our body really can respond to both chemical and mechanical cues. And when we hear needle injected in the skin, we think, that must just be damaging everything, causing all sorts of inflammation. But it turns out that low levels of inflammation caused by things like microneedling or PRP injections, or even the introduction of any kind of fluid, right? For instance, saline fluid injected into a region can cause changes in the cells in that region, causing, for instance, stem cell populations that were waning to reactivate again, causing telogen phase follicles that have melanocytes and stem cells that are dying off but not completely gone to re-enter the cell cycle. So microneedling procedures, PRP injections, things like minoxidil, they all kind of center around this same general theme of increasing blood flow, increasing oxygen, delivery of nutrients, or in the case of microneedling, increasing inflammation just enough at that local site that certain cascades of biological function that relate to proliferation of stem cells or maintenance of stem cell populations are kicked off. It's sort of like reminding the cells in that area that they need to stay alive in order to replenish whatever is lost. So sometimes a wound can actually induce some healing, although I do want to point out that the micro part of microneedling is absolutely key. And this should be obvious to you when you think about scars. I don't know about you, but I've never seen a scar with hair growing out of it. Or if there was, it was probably like one hair. But if you've ever seen a scar, if someone had their appendix out or if someone had a brain surgery, you see that scar because there is no hair growing out of it. So the micro portion of microneedling is extremely important. We are not talking about causing significant damage to a tissue in order to activate that stem cell population. We're talking about causing micro damage and micro levels of inflammation to stimulate growth.